Well, May is Skin Cancer Awareness Month, and this morning we have Dr. Derek Towery with U.S. Dermatology Partners with us this morning to share the dangers of skin cancer and what you should look out for. Welcome to you, Doctor. Thank you so much for being with us this morning.
Good morning.
So talk to me about being aware of skin cancer, especially as we head into these summer months with more sun.
Yep, skin cancer is very common, especially in this area of the country. It's actually the most common form of cancer in the United States. And we see multiple cases of skin cancer every day, and of course the dangers are even increased during the summertime when the sun is at its most intense.
Absolutely. So talk to me about some of the most common types of skin cancer and those who are most at risk for it.
So the most common cancer that we see is probably called basal cell carcinoma. That one is it's just a small tumor, can be small, but it'll grow slowly over time, not considered life-threatening. Then squamous cell carcinoma, a little more aggressive tumor, especially in people who are immunosuppressed. And then the most life-threatening type of skin cancer that we see is melanoma. About 1 in 200,000, about 200,000 people per year develop melanoma in the United States.
Now you talk about skin cancer in our area. What recommendations do you have for people in the four-state community to prevent these types of cancers?
Yeah, just be sun smart. We have people that like to farm, golf. We live in the lake area, fishing. So I encourage people to go ahead and do what you enjoy doing. You have to go outside to do your jobs, but just do it sun smart. Wear hats, sunscreens, and SPF 30 or above every day applied. We know that makes a huge difference in preventing skin cancer.
How long would you say you should wait to reapply sunscreen if you're out in the summer months?
Typically, I tell people about every 2 hours.
Okay, yeah, fantastic. And how often should people be checking for skin cancer, any spots or other things like that, and when should they get help?
Yeah, I mean, if you have a family history of skin cancer, if you're fair skin, lots of freckles, lots of moles, we recommend once a year. And then once we identify a skin cancer, then we're going to recommend probably every 6 months.
Okay. And when does treatment or self-treating at home turn into I need to go see a doctor?
Well, if you have a lesion that's changing, if it's irregular color, irregular bordered, or a lesion that's just growing really fast, bleeds real easy, that's when you should have it checked out. There's really no good home treatments for skin cancer. You need to see a professional.
Absolutely. Well, Doctor, thank you so much for being with us this morning. Lots of useful, good information to keep in mind, especially as we head into the summer. Happy to have you. Thanks so much.
Thank you very much.
Stick around. We'll be right back.
Thank you.